In this video, I'm going to talk about each of the 8 fundamental movements. The reason that I am so huge on these is that I want you to think about this as all of the things that you do in your life. Every single movement or action that you do is going to be some combination of these 8 movements. So if you need to pick something up from the ground, you're either going to have to squat down to do it, you're going to have to do a deadlift hip hinge type of movement, or you're going to have to go into a split stance lunge position. So if you have to reach out and grab something or pull something towards you, the push and pull are components of that. Walking, carrying, twisting, those are all of the main movements that our bodies have to do. And if you understand the key principles of those, because those are the fundamentals of all actions, then we can understand how to break down, how to progress and regress those. This is just a component of a larger lecture that I'll be talking about and some online mentoring soon. So if you think you're interested in doing some online mentoring, let me know, and then you can be part of the small group cohort. So let's talk about the 8 fundamental movements and then how to think about these in relation to your clients, how to think about them in relation to yourself. So in this video, we're just talking key principles. So the key things to think about with our 8 fundamental movement patterns. And just to review, those movements are squat, lunge, hinge, push, pull, carrying, so grip strength for carrying, twisting, and then our gait, so how we move, locomotion. With the squat, key principles are it's a lower body movement primarily, so we need hip, knee, and ankle mobility. The hips need to drop down into hip flexion, the knees need to flex, and the ankles need to be able to dorsiflex. Also, we need to have some degree of core stability. As you drop down into a squat, if you can't stabilize your core position, we're going to lack lumbopelvic rhythm, and the spine is going to do things to compensate for that movement. When the lumbar spine compensate, it impacts things above and below the chain. When going down into a squat, it's going to be a combination of glute and quadriceps activation. You can see in the pictures of the lady on the screen, she gets her hips back into the movement, and that action is what loads the glute muscles, it loads the hamstrings, and it also holds tension in the quadriceps. So quadriceps, glutes, hamstring engagement. And then also, if you go down into a resting squat position where you're in a tall upright spine, keeping your knees wide, what you'll feel is adductor engagement or even stretching of the adductors, depending where your tightnesses are at. So we need to be able to hold tension in our adductors. And if we let go of that tension, that's where we see that butt wink position happening. So we talked about hip, knee, and ankle mobility, but we also need ankle stability, the ability for the ankles to help hold position, not drop into excessive pronation, not drive out into excessive supination. So stability at the ankles from the ground up is a fundamental principle of the squat. Lastly, foot positioning is important. Typically, a slight 10-degree turnout of the feet helps open up the hips adequately, and that proper foot placement then is the setup for the rest of the body. You can change the squat. You can go more forward, but that turns the hips into more internal rotation. You can turn the feet out wider, which is going to be more of a sumo squat. But finding that adequate foot, the right foot placement for you as an individual, it's roughly going to be 10 degrees turned out on each side. But finding that person to person will be slightly individual. And then lastly, using good breathing techniques. So on the way down, kind of either doing a braced core activation or holding an inhale. And then as you push up, that's when you're going to drive out and exhale. Next, the key principles of the lunge. I'm just going to do the top 3 bullet points there together. We need mobility of the hips, knees, mobility and stability of the hips, knees, and ankles. As you can see in the pictures, it's a split stance movement of the pelvis. So one side of the lower extremity is going forward, the opposite side is going backwards, and the pull of that is going to be at the pelvis. So we need to have both mobility and stability across the hips, knees, and ankles. Because it's a split stance movement, there's less inherent stability. That's why people's split stance positions are going to be weaker than their squat or their deadlift, because it's just an inherently more unstable position, which is also why it's generally harder for people because they have to balance through a bigger range of motion. The other piece is if you look at the bottom picture in particular, or I mean either one, great toe extension or good mobility of the big toe on the back leg is a key important factor for the lunge. If you lack big toe mobility, you're going to see the lower extremity usually move into femoral internal rotation to try to compensate for that limited motion. Also, if someone lacks big, great toe mobility and extension, they're often going to lack mobility in their foot and along the one joint ankle flexors. So their soleus will likely be tight when they start losing great toe extension. We need core stability and strength. As someone drops into a split stance position, the ability to hold the pelvis neutral requires a good amount of core strength, specifically lower abdominal strength to anchor the pelvis in one position. Dynamic balance is dynamic because it's a split stance position with the feet wide, and it's typically thought of as a moving position. So that's dynamic balance. Again, proper foot positioning, and then breath control. The breath control is going to be similar to the squat, where you inhale and hold tension on the way down, and then you can exhale as you push up to work with the movement. Third movement is the hip hinge. The key principles of the hip hinge, maybe I do or do not need the first one, hip hinge mechanics, but that's the ability to flex through the hip while maintaining a neutral spine or relatively neutral. Likely people will go into some lumbar flexion, but when I say neutral spine, I really mean the ability to hold tension in the glutes and the hamstrings. If you practice this as you go down into a deadlift type of movement, if you lose too much neutral spine, then the force goes through the spine versus through the glutes and the hamstrings. And being able to maintain tension in the glutes and hamstrings is what's most important for this movement. It usually requires a posterior weight shift, and then you can practice that hip hinge movement using a dowel, using some verbal cues. But what you need is mobility and stability at the hips. So the hip mobility part, as you lower down into that movement, the hamstrings need to load or lengthen. And then as you come up out of it, they need to explode and shorten. So I think about it as a load and then explode, like a rubber band lengthening and then shortening. We talked about the spinal alignment, searching for more of that spine neutral position. Hamstring and glute activation is huge. The hip hinge or the deadlift is primarily a posterior chain movement. So maintaining activation across the posterior chain is the goal. Then we need knee stability. If you're tight through your hamstrings or you're weak through your ankles, so if your foot positioning is off, we're going to see that usually as the knees starting to cave in. So as someone goes down into a deadlift, the knees will turn into an internally rotated position. That's either because the hamstrings don't have enough stability or they're so tight that they don't have anywhere to go. So then they start driving, turning inward. Breath control with all of these. As you go down, I would say breathing in as you go down or holding brace neutral and then exploding up with an exhale. The push movement. So our push is anything, a push and a press are somewhat synonymous. So as you go into any sort of pushing movement, we need shoulder stability, and that's going to be the ability to drop the shoulders down, engage through the lats, engage the serratus anterior to tip the shoulders back as you push through that movement. So our pushing movements can be anything from a bench press to a push up to a military press where you're pushing the weight away from you. It requires shoulder stability, as I said, so being able to activate through the rotator cuff and deep shoulder muscles, chest activation, tricep activation, the ability to push away there is it's our pushing muscles back here. Scapular stability, which I touched on, is the ability to maintain a posterior tilt of the scapula and then also have some upward tilt, but then protraction of the scapula too. Core engagement is going to be huge. If you're not strong through your core on a push, you're likely going to overextend and lock out the paraspinals. When you do that, we lose power from our core. And if you lose power from your core, then we're losing power from our base of support or our center of mass. Proper hand positioning, there's different cues on this, but if you can see, I look for a neutral grip of the wrist, and then for a bench press in particular, and then you can see how the hands are in line with the elbows, which creates a nice shape at the shoulders to drive the movement through the chest. Breath control as you go down, inhale on the way down, exhale as you push back up. The pulling movement is going to be somewhat the opposite muscles with some similar core stability functions. With the pull-up, we're looking at kind of a braced scapular position that then pulls into scapular retraction and depression. So bringing the shoulder blades down and back as the chest goes into a tall position. Now that needs to happen from a strong core stability position as well. If I do that, but then I just really arch my back, that becomes a spine, more of a spinal extensor exercise versus strengthening some of the other back muscles. This movement, usually pulling movements, if you think about it as a like a close grip pull up or pulling something towards your body here, bicep activation and being able to use the bicep in relation to to your lats, um, to your traps, to your rhomboids. Those are all very important for pulling type movements. Grip strength is going to be super important for the pull. We'll see this also in our carry movement, which is another fundamental movement. We talked about core stability, proper hand positioning. Usually this is a relaxed neutral grip of the wrist. The ability to activate through here. If I don't have that and I try to use these muscles, it's going to turn on more of the wrist extensors, and I want more of a neutral grip position so we can drive our pulling movements through our back muscles. Breath control and positioning. As you pull down, exhale, inhale on the way back up. Pull down, exhale on the way down, inhale as you relax the movement away. The breathing piece is, I want to say it's somewhat individual, but I typically think of on the bringing it as you're pulling the weight towards you on this one, that's where you're exhaling. And then as you inhale, that's when you're releasing the tension from the body. The principles of a strong carry: grip strength and endurance, shoulder stability. That shoulder stability cue is going to be similar to our push and pull. The ability to get the shoulders back into position, locking the scaps into position to anchor the movement that way is going to be key. And that's going to transfer down into our grip strength. And you can practice this right now too. If you drop your shoulders forward, you'll see how that internally rotates the whole arm and then changes how we hold our grip. So then the grip becomes more on the inside of the arm versus being able to hold a neutral position through the forearm. That becomes important for people who then get tendonitis in their elbow, and it's going to be important for the efficiency of the grip. Core stability, as with all of these, we need to be able to hold spine neutral position. And I say neutral, this is going to change as you're changing your carry, or as if you have to bend down to pick something up to carry it. But on that carry, I want core in, shoulder blades pulled back, chest upright, where you can hold that strong grip carry position. Proper body mechanics, breathing control. On this one, breathing control will be more being able to control the pace of your breath, because as you're carrying something, it's going to be more of an isometric carry. So just being able to regulate your breath is going to be more important. Last two, twisting and rotation. With twisting, this is going to be using our deep core stabilizers or oblique muscles, and then in relation to some spinal rotational pattern. When you're twisting, there's going to be core muscle activation for sure if you don't activate your core on a twisting type of movement. So as I go back here, if not, it's going to load through the lumbar spine. So being able to maintain a lengthening tension through the obliques helps give you a strong core twisting position. Hip and spinal mobility is huge. The ability to disassociate what your spine is doing relative to your hip position is going to help you generate more torque and more power with twisting type of movements. So hip and shoulder separation, the ability for my hips to stay in one position and my torso to go another is a huge component of twisting movements. Proper foot positioning, this can change a little bit as you're going into the depths of rotation, but your foot positioning at the start of it is going to be more of like what your foot position is in a lunge, where you want both feet pointed forward, maintaining good dynamic balance to the lower extremity so the upper body can move in relation to that. Now, as you get to the extremes of sport, like in this picture, there's going to be some combination of forces moving together to load up tissue to then explode. But in general, we want to be able to separate what the lower body is doing from the upper body on twisting type of positions. Breathing control, I think you should practice this on your own, but typically as you go back into a twist, like you breathe in to help with the length and control of the position, and then exhale as you turn out of that. The best way to practice that would probably be like an oblique cable pull or the cable machine at the gym, where you can time your breathing with the different parts of the rotation. So if I'm pulling back here and out to pull across. Lastly, gait or locomotion. It's another split stance position. So you think about it similar to how we talked about the lunge, the ability for the pelvis to rhythmically go back and forth. That requires hip mobility and stability at the knees, so we're not losing position via our hamstrings and our quads. Ankle mobility and stability. With every step, if you overpronate or you stay too far on the outsides of your feet, that changes how the pressure disperses up through the lower extremity. It changes the pressure dispersion into the pelvis. And if you're too much of one way or another, we lose the function of the arch, the springing ability of the arch, which is where we get so much elastic energy. And if you lose that spring, you lose the elastic energy. Then what happens, if you lose the elastic energy in the arch, is that it becomes much less efficient. So it requires a lot more energy and a lot more mechanical strain on our tissues. Foot mechanics, core stability, just the ability to maintain a neutral position of the spine. That's going to be huge. So you make sure it's not a tail wagging the dog situation. Arm swing. So as you walk, I'm sure you've thought about, as the right leg goes forward, the opposite arm goes forward. Just like with running, it's a contralateral cross body pattern. Breath control is the last piece. This is one that being able to control your breath just through slow inhale and exhales is really key to autonomic nervous system regulation. But that's going to be helpful for maintaining core stability and efficiency of your gait pattern. So that's the 8 main functional movements and the key principles of each. We had our squat, our lunge, our hinge, push, pull, and carry, and then twisting or rotation, and lastly, gait and locomotion. So if you enjoyed that, I'm going to be having an even more lengthened video on the biomechanics of each one, and then common sort of mistakes or misalignments that we see, and what's the underlying causes of those. So again, if you're even more interested, send the studentphysicaltherapist@gmail.com an email, or look on TSPT website for my contact, and I'm going to start doing some online mentoring as well. So thank you. Have a great day.